Good morning, everyone. This is Kevin Doherty, and welcome to my fourth Medicare Conversation webinar for the 2020 annual election period, and my first with the new webcam. Before we get started, just a couple of housekeeping items. This 30-minute live event is being recorded. The recording will be posted at my kmdinsurance.com website by tomorrow, October 26th. If you are attending the live events, all attendees are in a listen-only mode. We have ample time for questions and comments. I do not have an agenda today. This is just an open forum, the opportunity for you to ask questions, provide comments, tell me about your experience with URL. If you would like to post a question or a comment, you need to use your GoToWebinar control bar. You may need to click on an arrow to enlarge the area in which to type. Your question will post on my screen, and I will answer questions and address comments in the order received. If you're viewing the webinar on my website, the recording, you may email me with any questions or concerns. So let's get started with the webinar for October 25th. Now, you may wonder what I've been doing since October 1st. Well, I thought I would show you this. These are just some of the review requests that have come in. So I no longer count the reviews, I measure the stack. Most of these reviews have been forwarded to URL Insurance Group for handling. Now, my first comment with regard to URL is I received very positive feedback from those who have used the service. The biggest complaint I received, excuse me, is someone hasn't heard from URL. And the problem is usually URL has sent an introductory email with a scope of appointment, and the person hasn't replied to the introductory email with available dates and times to schedule a call, or the person has not completed the scope of appointments form, which is an electronic form attached to a second email, which URL forwards. So URL is not going to reach out directly to you other than the emails. You need to respond to URL. So please go to your go-to box and type your questions, type your comments, and I will start addressing it. So my first question is, I do not have a Part D plan. Do I need one? Well, there's no obligation on your part to enroll in a Part D prescription drug plan. However, if you do not enroll in a drug plan at the appropriate time, a penalty would accrue, and it will be assessed if and when you enroll into a plan in the future. So, for example, if someone is without a drug plan for 3 years, that would be 36%. And that 36% would be assessed on whatever the average premium is as determined by Medicare each year. For 2019, the average premium is $33.19. So if the person were enrolling for January 1st, and if it were a 36% penalty, it's not based on the premium for the given plan, it's based on the average premium set by Medicare. And the person wouldn't be able to enroll at any time. The person would have to wait for the annual election period. What is AEP? AEP is the annual election period. Runs from October 15th through December 7th. And this is the opportunity, of course, to make changes to prescription drug plans. Is Medicare Advantage part of AEP? Yes, it is. The Part C of Medicare, which established the Medicare Advantage program, includes the prescription drug coverage, the Part D. So during this period of time, you may make changes to prescription drug plans and or the Medicare Advantage plans. So we're 10 days into the actual annual election period. We have 43 days remaining. Okay, Question: although I enrolled at Envision RX Plus on October 15th, the website still indicates I will pay the higher premium in 2020. When will my re-enrollment and lower premium for 2020 be reflected? All right, a little background with Envision. If you are in Maryland, DC, Delaware, New York, or South Carolina, you will be automatically switched from the Envision RX Plus plan to the Envision Secure plan. And in all likelihood, the Secure plan is not in your best interest. So Max has written to me, and Max has re-enrolled to keep the current Envision RX Plus. As of yesterday, 51 requests from my clients have been received and posted on my agent websites. The approvals or acceptance notifications have started. Max, I can tell you that your request has been received. It hasn't been processed yet. Envision needs to electronically connect with Medicare. So there's an electronic process, goes to Medicare, Medicare electronically approves it, and then Envision is able to approve it. So if this fact doesn't impress you, this is just me, so you can imagine what the companies are going through. It is electronic. I'm confident it will go through, and I am able to track it. So hasn't been done yet. Hopefully it will be completed soon. I have not gotten an email from URL. Well, I'll check on that. Please respond. Have you sent in a review request form? If the review request form has come in, I try to acknowledge with the word received as a reply for each one, and then I forward it on to URL unless you or your spouse currently are with Envision. Will URL assist with only Part D, or can they also help with Advantage plans? They can help with Advantage plans. I also offer some Medicare Advantage plans. Patricia, I can't remember off the top of my head where you're located. I represent Johns Hopkins, for example, which offers in several counties in Maryland, HMOs and PPOs. Yes, I mailed it to you. Okay, I'll double check. I'll have to check the stack there or check to see, but also you could check your deleted items for a message from URL Insurance Group. Most of the introductory emails have been sent by Karen McDaniel, so you can check to see if that's arrived. Okay, Medicare Advantage in Virginia. I don't offer any Medicare Advantage. I'm sure that the folks at URL will gladly help you with Medicare Advantage. And perhaps you listened to the webinar last Friday. If not, you may want to go to the KMD Insurance website and take a look at the webinar for October 18th. A little comment on my webinars. Candidly, I'll speak to people and I'm a little surprised that the word hasn't gotten out about URL or about what's happened this year, particularly with the Medicare Plan Finder tool. So I realize 30 minutes may be a big commitment, but in all prior webinars, my presentation is 8 to 12 minutes, and then the remaining time has been for questions and answers. So you can always go in, just take a look at the agenda and see if there's something that you're interested in. All right, I'm looking for questions and or comments. Particularly, here's a good one. Okay, I had my phone appointment with Kelly at URL and it went well. She spent an hour on the phone with me, reached the conclusion. She was knowledgeable, pleasure, and happy to hear that I'm still your rep. Thank you, URL and Kevin, for your help in making sure we're on the right plan. Well, thank you. That's Nancy. Thanks. Again, a lot of people seem to believe that my backing away from the completing all of the prescription drug plan reviews on my own is a sign of retirement. I'm not retiring. I did have an extremely difficult time last year keeping up with the volume. Without URL Insurance Group, I probably would not have offered the free service for this year, particularly with the changes with the Medicare website. So I wanted to keep it going. I would like to emphasize it is a free service. So in your case, Nancy, thank you so much for your comments. URL earns nothing for helping you because URL representatives didn't write a case. So other comments that I have regarding what's happening, particularly my perception of what these Medicare rules mean, is try and take some time, if you're a little computer savvy, to look at the Plan Finder tool on the Medicare website. For you as a Medicare beneficiary, particularly if you log in, it's an extremely easy process now. So the new Medicare Plan Finder is much easier to use. And my webcam has frozen here, but there we go. But it's much easier to use. It's just for me as an agent, I no longer have the opportunity to save information so I can call it up and edit for you. And I don't have the opportunity to generate the reports, which I did in the past. That's another complaint that I've received from many of my clients. Where is my email with the reports attached so that I could analyze it and make my decision? I can't do it anymore. The Medicare website does not permit it. Quick comment too about next week. There will be no webinar for Friday, November 1st. I'm sure you're all crushed about that, but I'll be back on Friday, November 8th. Okay, any other comments or questions? Please post it. Okay, this could be a short webinar, folks. We have 24 people on the line, so if you're interested, and I must admit I'm disappointed that I'm working with over 1,400 households, and I'm averaging about 70 people combined viewing the webinars, either live or through the recording. I can track the recording. So it's a little frustrating for me that the word's not getting out. When someone contacts me on October 24th or October 25th and asks me who URL is, I don't know what else I could do than keeping you updated and sending emails. And for some of my clients that don't have computers, I've sent letters. So I'm trying my best to get the word out. Maria, can I call you on the phone? Well, again, let me show you this, okay? This is what I'm dealing with. So I'm trying respectfully to stay off the phone, because if you do the math, I don't have the opportunity to run appointments for 15 to 30 minutes. URL is a company staffed with licensed representatives, and I don't know how much more they can handle. I was on the phone with my contact yesterday saying, I'm going to be on a webinar tomorrow. Do I need to tell folks it's time to cut it off? Because appointments are being set for a month out right now. So respectfully, when asking for a phone call, could you tell me why? Maybe we could handle it via email. It's much easier for me. And I personally haven't completed getting all the reviews out. Okay, will I automatically be enrolled to United Healthcare? United Healthcare offers both Medicare supplement and prescription drug plans. But Margaret, I think that you're referring to the Medicare supplement plan. There is no enrollment period for Medicare supplement. I addressed this last week because there's a great deal of confusion about this. I'll do a drug plan review, and then the person writes back, well, what about my Medicare supplement? And I do my best to keep up with those questions and answers. No enrollment period for Medicare supplement. There is a one-time open enrollment period when a Medicare beneficiary is new to Medicare Part B. That expires 6 months after the Part B effective date. So you could change your Medicare supplement at any time, but you would need to disclose information about your health. So those that have Medicare supplement in place, the Medicare supplement continues on. As long as you pay the premium, your Medicare supplement is going to continue. You don't need to take any action whatsoever with the Medicare supplement. Now, in the unlikely event that you're referring to the prescription drug plan, the prescription drug plans typically continue on without any action. But as we've discussed in the 3 previous webinars, Envision does require action this year. Anyone who has the Humana Walmart plan will be automatically switched to a plan which in all likelihood would not serve well. So there are exceptions, but typically the plans continue on year after year. All right, next question. By what date should I be concerned about no processing? May I contact Max? I'm tracking it. I have right here from Envision a listing of all of my clients. My associate and my wife Liz is helping me. She's helping with scheduling phone calls now. She's helping me with this process. As I mentioned earlier, my agent website is being loaded with all of the requests. So we are in day 10 of the annual election period. It's okay, just relax. I'm going to be attacking this probably the second week or so in November, making sure that all of the requests move to being accepted for Envision. And then I have to reach out to all the people who have been silent to this point. So Max, there's nothing to worry about. Just give it a little bit more time. Okay, we got comments coming in now. Pamela, thank you. I appreciate your comments. Maria, did our review, okay, I think what you're asking me is, did your review go to URL? And now this is a bit personal, Maria, but I did your review. I did your review and your husband's review, and I sent it to you, and you replied to it. So no, if I do the review, I'm not sending it to URL. I handled your review. Debbie, can someone who does not qualify for Social Security enroll in Medicare? Now that's a good question. And the typical answer is no. You need to qualify typically for Social Security. Now, if someone arrives from a different country to the United States, the person could become eligible for Medicare after 5 years, but the person would have to pay for Part A in addition to paying for Part B. If you are married or if you were married, you may qualify for Medicare and Social Security based on the tax history of your spouse or former spouse, but you may have needed to be married for a given number of years. Now, that's my understanding. If you need additional information, please go to the Social Security Administration. The toll-free number is 1-800-772-1213, where you could also give your local SHIP office a call. That's SHIP. That stands for Senior Health Assistance Program. Senior Health Insurance Assistance Program. And they go by SHIP. Okay, Margaret, you are welcome. Debbie, the person is 74 and an American citizen. Well, again, it could come down to tax payment history. So the person should be eligible if either he or she paid sufficient taxes or the spouse paid sufficient taxes. And again, the person may be eligible for Medicare, but may have to pay for Part A. Now, I don't have my notes on what Part A costs now, but Part A, if you had to pay for it, costs approximately $450, somewhere in that range. Now, for us, all those FICA taxes that you paid, all those decades, that gives us premium-free Part A. So no charge on that. Pamela, interesting. I've gotten some spam email telling me that Envision RX is increasing, almost doubling. If not for you, I probably would have fallen for their tactics and looked into changing plans. Lots of spammers out there. Thank you for your honesty. You're welcome. Yeah, I've gotten quite a few comments on that as well, and also with the Humana Walmart plan. Now, let me defend the insurance companies a little bit here. This administrative snafu is not the insurance companies. It is Medicare. So for some quirky rule, Envision introduced this secure plan And candidly, my understanding is it's for low-income people. As an agent, I can't even offer it. And for Envision to write to me to say it's probably not in your client's best interest to have it, that's quite telling. But the Envision folks are forced by Medicare to move residents of Maryland, Delaware, DC, New York, and South Carolina to the secure plan unless the Medicare beneficiary takes action. Same with the Humana Walmart plan. Now, this is the second time that this has happened with the Humana Walmart plan. So for this year, the Humana Walmart plan is changing its name to the Humana Walmart Value Plan, off the top of my head. And so because of that change, the current members of Humana Walmart must be switched due to Medicare rules to the Humana Premier Plan. Well, I believe it's a fair statement that if you are well served with the Humana Walmart plan, you would not be well served with the Humana Premier Plan because that premium is more than doubling for folks. And that person with Humana Walmart would probably be well served re-enrolling into what is now known as the Humana Walmart Value Plan, or perhaps changing to another low-cost plan. All right, so what's next here? Okay, we talked about that one. All right, so Barbara, do you want a copy of the Envision form or just notification that I sent it in? If you could just email me and let me know that you sent it in, because here are my piles for Envision. So this is one where I may have done a review and told folks you need to send in the form. I have a marked up copy of the form that helps you. This is the pile that's indicating the folks have told me that the form has been sent. I then cross-reference it to the website. It's a little premature for me to do any other work because only a couple have been accepted at this point. And then I also have the listing from Envision for all of the Envision cases for which I am the agent of record. And Liz and I are going to go through and make sure that everyone is aware of the change and hopefully take in action regarding it. So no, I don't need a copy of the form, but I would appreciate it if you would let me know. All right, we have a few more minutes. Any other questions or comments? Let me look at my list here, see if anything. Is Medicare supplement bound by the AEP, the annual election period? No, we discussed that. And all right, so people have asked all the questions I were hoping for. And I do appreciate those of you that have consistently listened in on the webinars. It helps me out tremendously in getting the word out. All right, I'm going to pause here for a minute or two, see if anyone else posts anything. Here we go. I now have Aetna Medicare Select. All right, well, Frank, I don't want to go over your review with 24 other people. So please send me an email and I'll address it. Now, on your webinar, Envision does not exist any longer. No, Envision exists. If you have Envision, you're going to be automatically switched to the Envision Secure Plan unless you take action. Okay, any other questions, comments? We have quite a bit of time, actually. So I'll hang on for another minute or two. If nothing comes in, then I'll shut it down. And I will not be holding a webinar for Friday, November 1st. Okay, Frank, terrific. I responded to your email. I completed your review, Frank. So, and I sent it to your email address, not to your wife's. All right. I hope you like the webcam. This was a gift from my son for my birthday. And my son is the man who helps me out with the website, posting it for me. So shout out to my son, Johnny. And looks like we are out of questions. Oh, wait. Okay. Great webcam. Thank you. Thanks again. Happy birthday. Thank you. It was last Sunday. I appreciate that. I usually spend it running drug plan reviews. All right, folks, I think we are out of questions and comments. So thank you so much for your time. If you have any additional questions, feel free to email me. And I will be back for November 8th. So thank you so much. Have a great day today.